If you have well-controlled inflammatory bowel disease, you may wish to simplify your medication list. So in this video, I'll discuss my general approach to doing so. In a prior video, I discussed which patients are candidates to consider stopping medications. But more often, for patients who are on multiple therapies, I like to simplify their regimen. So let's discuss how to do that. First of all, which medication to stop. For patients on dual therapy, a biologic such as adalimumab and an immunomodulator such as azathioprine, which one should be stopped? Data shows that when the immunomodulator is stopped and the biologic continued, relapse is uncommon. But when the biologic is the one that's selected to de-escalate, relapse is actually pretty common, near 50%. It's that data that makes me hesitate to stop a biologic therapy unless there's strong patient interest to do so. I like to see a patient has been well controlled for over a year to allow for the natural ebb and flow of inflammatory bowel disease. This way we ensure that they aren't right on the cusp of a flare that could lead to total loss of control of the disease if we were stopping medications. So when a patient is on more than one medication, I'm usually stopping the immunomodulator and continuing the biologic therapy. Not only is it important to stop the right medication at the right time, but it's also important to enter this with the mental preparation that you may need to resume your medications should you start to have symptoms of a flare. And it's important to have a plan to detect that flare as early as possible. And sometimes symptoms are a late sign, and so we want an early marker that a problem is occurring. To do that, we check a drug level of the medication that you plan to continue. Why? Because we want to see that it has reached adequate levels that are known to be effective. We essentially want to make sure that it's carrying its weight. After stopping azathioprine, I like to recheck the drug level after a few rounds of dosing to ensure that it maintains similar levels. The reason for that is immunomodulators play an important role in complementing biologic therapy. Some of that is a synergistic effect. You're attacking inflammation from multiple angles. But it's also believed that azathioprine, through not fully understood mechanisms, actually boosts the levels of your biologic therapy. Immunomodulators suppress the immune system to decrease the risk that your immune system will recognize the biologic therapy and inactivate it. Once that effect is removed, there's more risk that your immune system may come to recognize your biologic therapy and lead to waning drug levels. And so the earliest way to pick that up is by rechecking drug levels. By proactively monitoring biologic levels, we can be alerted to a failing therapy long before symptoms return. Mesalamine and similar therapies can be reduced to a low dose. These therapies soothe the colon, and they may decrease the risk of cancer. That's been demonstrated in some studies. However, as we gain more confidence that biologic therapy knocks out inflammation, it may over time prove this alone reduces the cancer risk that is associated with inflammatory bowel disease. So in the future, we may come to be confident that biologic therapy can be a solo therapy for effective control of inflammatory bowel disease. When you taper your IBD medications, it's important to keep track of inflammation and also keep on top of the risk for cancer that is associated with inflammatory bowel disease. And ultimately, the best way to do that is by having the occasional colonoscopy and keeping in touch with your GI team. We'll discuss the approach to surveying for dysplasia, a mechanism of inflammatory bowel disease that can lead to cancer, in a future video. So please subscribe to the channel to be alerted to its release. Thank you and be safe.